Okay. Good evening, everyone, and welcome to tonight's call. I am Audrey Warwick, and I'm joined tonight by Dr. Lauren Pepper. And we're just so grateful that you're all here on this call tonight, whether you found us through Dr. Pepper's practice or through the whole tulip or through our simple wellness community and just the friends that have shared to just invite people to learn tonight really about functional medicine and how to get to the root cause of what's going on inside our bodies that's causing some of the chaos that leads to symptoms that don't make us feel so good. So please know that we are just so happy that you're here. And our call tonight is, and our intention really is just to provide education and some inspiration and some hope. So when Dr. Pepper and I were talking about ways that we could collaborate, she said, why don't we use your story? So why don't we have you be the topic? And so I said, sure, I'm ready. I am ready to share the sort of health crisis, if you will, that I have experienced and where I am today through the help of Dr. Pepper and others that have really helped me discover what's going on. So just to give you a little bit about Dr. Pepper, she is a chiropractor with Innovation Health. She owns it with her husband, Dr. Brad Wolf. She also went back to study functional medicine. So she now offers a very comprehensive approach in her practice to really help people heal their mind and body. So you're going to love her. She has great contagious energy and just a true passion for helping people find better health. And then a little bit about me. I am a mom of two boys. I have a 13-year-old and a 16-year-old. And I've been in the health and wellness industry for about 20 years, first as a neuromuscular massage therapist. And then after dealing with a chronically sick child when he was 2, I went back to study nutrition to become a holistic health coach. And since I've gone even further in my journey, I am now back in another program to become a functional nutrition practitioner. So this will allow me to learn and run the labs that we're going to be talking about tonight to be able to offer a more comprehensive approach with my clients. So I'm very excited to be back in the learning process. So like I said, I am a health coach. I co-own the Whole Tulip with my sister, Carolyn Hallett. So we do health coaching and nutritional consulting. And I'm also a leader in our simple wellness community, which is comprised of like-minded individuals who are committed to providing solutions to help people find better health. And we partner with the Juice Plus company to help people find simple solutions to fill in nutritional gaps. So I wear many hats in the community, but I love them all. So Dr. Pepper, do you want me to kind of just get going with my story, or?
Let's jump right in.
Let's jump right in.
Lay down sort of the, perhaps maybe like the 40-foot view, so to speak, just sort of the overview of, what happened with you. I mean, everybody knows that, you mentioned that you have a journey back to greater health. You had a bit of a healing crisis. From what I remember, your journey actually even started when you were like in your 20s. Right?
Yeah, when you go back and look at patterns, right?
Which is so important in the functional medicine model. Like we want to focus on where are you now, but we also have to go back and look at the big broader strokes and say, how did you get here? Maybe we can uncover some of these triggers, these things that cause us to go into more of like a dysfunctional pattern, not necessarily the healing crisis, but the things that lay down the tracks where we might start to notice that we have dysfunctional, if we pay attention, we have dysfunctional patterns that are starting to brew. So I think that's a good place to just start with that overview for you, Audrey. Let people know how things went with you.
I mean, if you go way back, right? I mean, I think I can always identify with a lot of hormone imbalances. I went through infertility with my second son, and just kind of a lot of things that didn't make sense then, but I didn't know what I didn't know. But it was really back in 2010 when like I said, I went back to studying nutrition because I wanted to figure out why I had one child that was getting sick all the time and the other one did not. And that's when I really started learning about food as medicine and just the lifestyle changes. So we did that and we had dramatic changes in our family, so much improvements in our health. And that's when I was growing my coaching practice and really helping a lot of people. And then in 2015, we moved to a new house. And that's when things started to change.
So 2015, now the kids you have that you had the second one as a 2-year-old. That's when he was starting to have some challenges. So now they're, much older. They're more,
they're
not little ones anymore.
12 and 7, 8.
Right.
So I started to, again, a lot of these symptoms, like where we all just kind of think are normal, we're tired, we have these hormone imbalances.
You're a busy mom. You're kind of, it's
busy
easy
mom.
to just, yeah.
Right. But when we moved in this house, then some changes started happening for my kids. I feel like we always put our kids first. So my younger son started developing severe anxiety and sleep problems and just a lot of emotion regulation. He could not regulate his emotions. And so that's stressful. And so, every night when your kid is having, a major anxiety attack about the act of falling asleep, it's very stressful on the whole family.
And this was new. Like this was new.
This was new. He had not had these issues. And then my older son developed exercise-induced asthma and acne, which, right, you can attribute those things to puberty. And then my husband developed skin issues that, we weren't connecting all these dots, but it was in 2008 that stress really hit our house. We had a family crisis or a crisis with a family member that for about 6 months was extremely stressful. So I was under tremendous stress. And, when you're dealing with something like that, you just deal with it. And it wasn't until kind of talking through timelines with you and looking back at some stuff that I look at my health really took a dive after that 6 months of stress.
Yeah.
So it was then that I started experiencing massive fatigue. I was crashing at 3:00 in the afternoon. I could barely pick up my kids from school, barely get dinner on the table. I was asleep by 8:00. My family and friends were always laughing at me. They're like, you just always want to go to bed. And I'm like, I do.
So pause for a moment, everybody, and just take that in. The 4 people living in this house, and they're all presenting with symptoms, and the symptoms are different, right? So you can see how that can also start to become that can be confusing because you're not really connecting the dots that, wow, is there a connection with moving to this house that maybe had changed the physiology of all 4 of us, anxiety, and then, one asthma and acne, and the other was starting to have skin issues. And then now you're having, fatigue. So all of these things, the undercurrent of that, Audrey, and everybody on this call, because I like to kind of interject the thought process behind the way that we go about correcting this or uncovering it. All of those are indications of some kind of toxic load that is more than the body can handle, right? That's how it's showing up. Okay.
Right. So that's actually how I started putting some of these pieces together. So I started looking at, I had neurological symptoms. I had brain fog. I could only react to what was coming at me, like the whole
right.
act of planning and being creative was flat, was gone. And I'd had some labs done. My vitamin D was super low. So it was like, okay, why can't I absorb D despite my lifestyle? B12 was low, again, source of energy. I was having mitochondrial dysfunction. So that's energy going to your cells.
Do you guys remember the mitochondria? I don't know where everybody is on this call, but somewhere in your schooling, usually elementary or junior high, we had to make the mitochondria models with the styrofoam balls. Remember that? Or maybe your kids did. And the mitochondria is the powerhouse of the cell. That's all you need to remember. Right? If you don't have energy in the cells, you're going to have fatigue. You're going to have all these downstream issues. It's just a lot of problems. So,
yeah. So that's when all of a sudden I'm like, wait, I haven't changed my, when you're not eating well, or when you're not sleeping, or you're not hydrating, or you're not managing your stress. And I'm like, I'm doing those things. I never stopped doing those things, but my body was not able to do those things any longer. So, it was through the functional medicine community here in Charlotte. My friend, Dr. Sheila Cobain, had one of her colleagues speak and started talking about detox pathways, and started talking about when they're not working properly, and how some of us have genetic SNPs and, we don't detox well, and how it can cause this whole backup, and it can cause all these deficiencies and, mitochondrial dysfunctions. And all of a sudden I'm like, wait a minute, is there something that I'm being exposed to that is causing this? So I ended up doing functional lab. I did organic acid test, Dutch test, and a mycotoxin panel. And the mycotoxin panel revealed that I had a lot of mold. And so right then and there, everything went back to, you have to look at your home environment. And so we did, and it was difficult to find because our house was dry. We did not have a moisture issue, and that's what you go looking for. So finally we got the proper mold people in to come look, and what it was is we had old mold in our crawl space that was not remediated properly. So it was looking for a source. And when mold doesn't have a source, moisture, it gets pissed, and it emits mycotoxins, which is what is toxic for us. So since we moved into that house in 2015, we moved in with that situation. So it wasn't like it was a new situation. So it essentially was slowly poisoning us. And again, so, I was like, okay, for several years, I was able to tolerate it to a point. But then when that major stressor hit in my life, it tipped everything over, and I could not recover. So it took, we could have a whole nother conversation on mold. And if anybody on this call is dealing with mold or suspects mold, I'm happy to have that conversation and be a resource. But you have to move out. You have to, if you're going to get well, you have to be in clean air. So we had to move out and live with my sister for 3 weeks. I was barely functioning at that point. My sister was like laughing at me. She's like, you can't even do laundry. And I was like,
wow.
this is where I am.
Wow.
But I was great. It was great to have family there to support us. So we did, remediate. We got our house clean. I did end up having kind of a panic attack going back to the house, knowing that it was so sick. So we did end up moving right when the pandemic hit. So once we
what's one more stressor?
one more stressor. But to not lose sight of the kid piece, once my kids detoxed from the molds, the one son with the anxiety and all the emotion regulation issues, gone, completely gone. That kid is thriving. Like stuff that he would say, hell no to, he is diving right into. So,
Yeah.
and my older son has no issues with the asthma. His acne is cleared up. My husband's skin is a work in progress, but it definitely looks better and it's less reactive than it used to be. And then that leads to where I am now, which you can tell everybody.
Wow. Well, thank you. I mean, that was a good recap. Now, I will say that I've heard similar stories where, there's a crisis, something happens, pushes people over the edge as far as some kind of stressors. And it's not always mold. It could be menopause. It could be after you have a baby. It could be the birth of a baby. It could be the death of a loved one. I mean, it's just so many things, and everybody's so different. That's the beautiful thing about functional medicine, is it takes into account that you're an individual, you have your own genetic makeup, your genetic suit that you come into the world with. That we don't have control over that. That's what we get, right? You get what you get. You don't be upset.
Right.
With the things that we do have control over, though, are the environment, right? Environmental toxins, what we put into our body, how we manage and handle stress, how well we sleep. So diet and lifestyle. Dr. Mark Hyman, who's pretty big in the functional medicine world, he makes a comment about genetics, and he says genetics is the loaded gun, and our environmental toxins and our lifestyle and habits is like the triggers that pull the gun, right? Mm-hmm. So a loaded gun doesn't cause any harm. It can be very protective for people, right? So, but if you have a lot of these environmental triggers or stressors, and they start to demand more on the body than the body can handle, then now you start to have a backup in so many words. Like you can start to have, say, like a backup of drainage. Right. Mm-hmm. Am I talking too loud? I don't know the volume. If it's
no, I think you're good, because everybody here has their own volume. Yeah.
Okay. So everybody can. Okay. This is a very exciting thing for me. I love talking about this. I love helping people uncover what's really going on. Right. You got to get to what's really going on, and how you get there, Audrey. When she came in to see me, is first we start with a thorough examination. As a chiropractor, I'm a big believer that you have to make sure that you have spinal alignment. You have to have structural integrity, right? So if somebody has weakness in their ligaments or joints, they're not going to be stable. And that's kind of like energy leaks in the body, energy leaks that can cause other mitochondrial problems or downstream issues. So it's really important and foundational. We do an examination, neurological, orthopedic, chiropractic, kind of looking at the person standing, sitting, lying down, feel their spine, looking for any kind of clues, trigger points, stress patterns, misalignments, so that we can immediately start to get the body's systems start to wake up, right? And in some cases, we have to calm things down. There might be a lot of inflammation, right? So, and sometimes it's both. So no matter where you are in the world, I do hope that you're getting some kind of physical care, whether it's from a chiropractor or a massage therapist, or I mean, there's just so many ways that it could be done. But I find that, I've been doing chiropractic for since 1997, and I've had such profound experiences with my patients that were not related to back pain, neck pain, headaches, that kind of stuff. Really, so that kind of leads me into taking it back to Audrey, that so many folks, whether they're, toxic from an environment, or if they are just going through life changes and they're having a hard time adapting to that. I mean, right now we're in a place where there's so much going on, even presently with all this pandemic stuff that's just going on for a while. We've had to make so many changes. Children at home, children at school, children back at home, working from home, working at your office, like all these things that we just feel like maybe a little out of control. So these things can all kind of stack up against us, and we can start to lose that vitality, or feeling like, we just noticed something's just not feeling the same. Like we're not feeling like we used to, right? And it might start with, like with Audrey, one of her, when I start with patients, when we get into after the examination, we'll start doing some metabolic assessments, I always like to get the patient to identify what are your health concerns that you have right now, right? What's going on? So Audrey, I'm going to go ahead and share what you had said to me, okay?
Mhm.
She said number one was hormones, number two was neurological. Right there, those two things are huge. There's so much going on that you can feel overwhelmed, just trying to get someone's hormones balanced and also getting their brain to start to wake up and have brightness and feel like you have focus and concentration, not having mood swings or energy shifts. Then on top of that, she was concerned about weight. That's not uncommon, right? When energy is not working right. And of course, inconsistent energy was another one. And then digestion. So those are, Audrey, I will say, by the time that she came in to see me, Audrey, I think that you did a really good job working with these doctors, working with your practitioners and on your own, just kind of digging deep, asking the questions, looking for the clues, being a great detective, right? Because that's really what this is. And also being such an advocate for your family, right? It's for your child that you had to wake up and say, wait a minute, something's not right. And then you started to make changes with your diets and putting better nutrition into your body. But interestingly enough, by the time Audrey came to me, I said, Audrey, you're doing so many things right. She was already doing she was eating clean. She was, I couldn't find, there was nothing there that I would say, Audrey, you must do differently. You're, drinking too much alcohol or you're eating too much of this or that. No, it was nothing like that. For Audrey, and Audrey, do you remember me saying that to you? I said, love, you're doing so many things right. But
That's why I was like, help me. What am I missing?
Right. And I remember that note, like back and I said, you know what? I said, there is, you're having leakiness here. Like you're not absorbing, like you're taking all these supplements and you're, eating so healthy, but her labs were indicating such malnourishment. So of course she's going to have brain is going to be sluggish, body's going to be sluggish, digestion is going to be all over the place. So I hope everybody, can identify that that's how this stuff happens, right? And not always. Sometimes it's a little bit more like, oh, you know what? We just need to get you stopping so much of the fake and junk and processed stuff and get you to eat more live, fresh, whole foods. But in your case, you were doing that. So we had to really dig deeper and identify what was going on here. So the next part of what I like to do is just to take that deeper dive of when we go through the assessment and to see, like we basically are looking to see what body systems are showing up as being less than optimal with your functions, right? Are you having diarrhea? Are you having constipation? Are you alternating back and forth? In Audrey's case, she was tending to have not so much backed up bowels. She was having a lot more of loose, like things were just passing through her pretty quickly. Right, Audrey? Yeah. Yep. It wasn't dire, but there were some times when, it wasn't pleasant for her. She would eat and she would not always feel so good. Other times she felt fine. Again, frustrating because you can't nail it down. Right. So
and I did feel grateful because I know the digestion could have been a lot worse. Like just knowing other people, have had similar toxic exposure and, it can result in SIBO or it's a lot of bloating.
Yes.
After meals, like a lot of discomfort in digestion.
Yes.
But I know it wasn't working well, even though I wasn't experiencing a lot of those symptoms.
Right. But when we actually dug a little deeper, and I'll show you in her lab work in a moment, but really what I want to point out is that if we kind of think about soil and terrain, if you're growing a garden or just, having a potted plant, you want to make sure that you're giving that plant or that live vegetation needs to have proper soil, right? It has to have proper pH in order for it to thrive. And that is how our bodies operate too. It's so foundational that we have this more alkaline pH in the body. And most people, when they are starting to have a decline in function, they tend to have problems with that, right? So it could be that they need more minerals, they need more electrolytes. So really, it still comes down to they're not absorbing what they should be absorbing through the natural process of digestion, right? So where does digestion really begin? Let's just tap on that for a moment.
In our mouth?
Yeah, exactly. Digestion begins in the mouth. So it's real important to make sure that you have any kind of bacteria infections or bleeding gums. I send more people out to
I did get rid of my amalgams in my mouth.
Yes.
That was part of my detox.
Yeah, because every time you're
got rid of the
chomping
metal
down,
in my mouth. Yeah.
Yeah. So, if you're chewing and you have a lot of these amalgams in the mouth, which are the mercury fillings, the silver fillings, for those who may not know what that means, it's old school, the way that we've been told that that's the way we need to have our cavities taken care of. On top of that, just the day-to-day brushing of our teeth using fluoride laden toothpaste, right? Which is a halogen, and it blocks so many of the processes in our body, especially when it comes to the neurological and the hormonal, right? And digestion. So these day-to-day things, we don't always know what we don't know, but when you start to pay attention and you dig down and you start to peel away the layers, you can start to make sense of the madness. So, with Adri, there's a lot, I'm looking at her initial assessment. This took place back in May. That's when I started working with Adri. The other thing that I noticed with Adri was that she was starting to have intolerances, not only to smells and to sort of the environmental things, like, maybe just walking into, say, Bath and Body Works, one of those really perfumey places, and it might just hit you and give you a bad headache or just make you feel terrible. You lose your energy. If you start to have intolerances to your environment, you also tend to have intolerances to your own cellular body. And that's where we start to have these barrier compromises. One of the majors that people hear a lot is this term leaky gut, right? So what that really is telling us is that if a barrier between the blood and, say, the intestinal lumen, where your digestive system is breaking down the food after you chew it really well in your mouth and then you swallow it down, it's going to go to work to start to turn that food into, cellular energy, right? So, and then it's going to get picked up, moved into the bloodstream, and delivered out to all the different areas that are demanding that. You don't have to control this stuff. Our bodies are so smart. It does it all on its own. That's the beautiful thing about this. If you can just start to clear out the mucky waters and start to get better natural detoxification of your body systems, right? Which is mainly liver, but liver never acts alone. And then you can start to, on top of that, start to repair and heal digestion, whether it's a leaky gut or maybe not. Maybe it's just something that is a little higher up. Maybe they're having, trouble in the gastric area and they've got like ulcerations, or maybe it's, maybe they have blockages in their bile flow. And so they're having a hard time breaking down their fats and turning that into energy. So without going off on too much of a tangent, any of these things that show up, they might appear like day-to-day things that you might have going on. So it could be, say, joint pain, could be fatigue, which is what you had going on, allergies, allergies. So allergies, allergies to food, allergies to the environment, allergies to both. I mean, how sensitive are you? Those are also indications that there's a toxic burden that's not getting cleared out. And so now you have your own cells swimming around in this, not so great terrain, right? It's more of this soup of toxicity. And now your cells are going to absorb toxins, recycle them, try to turn them into fuel and energy. And you can see after a while that, in Audrey's case, it started to really have a detrimental effect on her in her day-to-day. She couldn't really function. Just getting through the day was a chore. Now, other things that I saw with Audrey that were, and they were, let's just say that without sake of time, there were definitely—
Arnie, don't do that.
What's that? Oh, is somebody talking?
Yeah, I think somebody's unmuted.
Oh, so She was also having a lot of bloating and gas, not always after meals, but just bloating and gas. It could be after the meals. It could be, other times of the day. Her energy started to shift in the afternoon. Like she would get real fatigued in the afternoon, crash down. And after she ate meals, sometimes she would get real tired, right?
Mm-hmm.
Right.
Yep.
So those are really big clues that this person's cells are really needing some help. Things are bouncing all around the place, which is going to make her moods all over the place. It's going to make her hormones kind of move all over the place. Digestion, energy, everything's going to be very unpredictable. So in order to clean that up, we needed to start somewhere. So we started by just cleaning out the terrain, getting rid of toxicity, even more, opening up some of her drainage funnels a little bit more predictably, so that she was having not like normal healthy bowel movements. Like Audrey, right now, would you say that you're on the Bristol stool chart, or your bowels?
I get an A+
Stool chart.
most days.
Wait, I don't know whether y'all can see that. I didn't share. If I was just to share the screen. Okay, this is one of the things we talk a lot about bowel movements when we first started. It's a big clue. Bristol stool chart. Someone named Bristol, I think his name was Bristol, came up with these nice guidelines. So there's basically 7 different types of bowel movements, and nobody tends to stay in any one place because we're not meant to have, everything's not going to always be the same. But really, where we like to hover is type 4, right? Smooth empty. So I just wanted to put that up there because that can be a helpful clue, right? We're looking for the windows into what's going on in the beginning. So we start with a nice consult evaluation, a good deep dive in your history, which we did. And then we have to get into action. So action is going to be, like I said, clean up the terrain, get the pH to become more alkaline, get you to start digesting and absorbing your food so you could turn it into energy. And then lo and behold, Audrey comes in for a follow-up and she says to me, I feel so good. I'm ready to get back to work. I have energy. My brain is working again. I'm not fatiguing out. I'm sleeping better. Like bright light bulb, back on track. Yes. And so, that's what's kind of let us, now we're here we are, because I said to her, the truth just comes out. I said, Audrey, maybe you'll come and be a health coach with me, and we'll be able to, I need help. I'm helping a lot of people, and I can't do it all. I'm just one person, right? So where my wheelhouse is helping people to uncover what's going on from the clinical perspective, do lab evaluations that really help to dig a little deeper and see how, like, where do we aim the arrow? Where do we start? Where do we begin with each person? And like I said from the beginning, everyone's individual. So it's not going to be a one size fits all, which is why this is such a beautiful model, right? All right.
One thing that will you touch on that, because I think that was very eye-opening for me, that I would not have thought would have been an issue, was blood sugar for me.
Yes, it's huge. It's hugely overlooked, hugely overlooked. So in your case, the reason why it wasn't, some people eat too, well, let me back up. Sometimes it's a matter of not digesting or absorbing the food well, right? So if you're putting stuff in, but it's not being able to churn it down, sterilize, create this nice system of acidity, which happens in the stomach. If that terrain right there is out of balance, or even if one step up in the mouth, which I started to touch on, which is phase 1, step 1 of digestion, some people don't make enough saliva. They're all thirsty a lot, and they just aren't producing enough saliva. Well, that's a brain issue. That's neurological. Saliva comes from the glands in the brain. So, and there's a real connection between the brain and the gut. So when you're not absorbing well, let's say you're not a person, in your case, Audrey got hit really hard because she was having a hard time digesting her carbohydrates, which convert down into glucose, and glucose gets uptake into the cell and it gets turned into energy, and it's fast energy. and it's necessary energy for every cell in your body and brain. But if there's a conversion issue, if you're not able to take that and convert that, then you're not going to be able to get that energy. And now that food is just kind of hanging out in the digestive tract, not getting digested down in the timely fashion that it needs to. So that's a problem. In your case, also, Audrey was burning through her fats. She was trying to use fats as a way to get energy. But it was at the cost of a lot of her hormones, because you need to have fatty acids in order to be able to make a lot of really important things in your body, including progesterone, hormones for your stress. I mean, and so many more, testosterone, estrogen, all these things they need to have fats. So I'm trying not to take something too complex in 1 hour and try to get into too deep of a dive. But the bottom line is that Audrey was having trouble getting her fats, her proteins, and her carbohydrates to break down into smaller and smaller molecules of energy so that they could cross over, enter into the blood, and get taken into the cells and do what they need to do so that they help her body function. So in many categories, she was starting to lose this process. And that, when we take back to the mold is like the wild, wild west. It is unlike, it's so toxic for some people, but not for everybody. Okay, so just to be clear, some people, I mean, it's very toxic and nobody wants to be living in a mold environment, but you see how each person in your house handled it differently, right? Everybody had a change. And so we don't want that. Mold is like a vapor. It's more of a gas, and it can cross over all the barriers. So it's very tricky. And what mold tends to do is it tends to create blockages of flow. So that's where you can start to get, like, the pipeline's now starting to get backed up. So you're getting more of a toxic load, and the energy that's supposed to be going towards your body and brain and helping you to, thrive is now being basically hijacked from you and used to feed more of a very inefficient terrain, which is now highly acidic and working very much against you. So no matter how much you were eating and how many supplements you were taking, there was only
spending a lot of time and money that was not being utilized well.
Right. And that happens so much. I mean, I cannot begin to tell you how many times when I started doing this, before I knew what I knew, I was probably one of those practitioners that people would say, oh my gosh, she has me on all these things and I'm not getting better. But I always kept digging and I kept learning. And, this is not a straight line. It's not a one size fits all. So the need to have somebody who just can make sense of the madness is really helpful. And there's a lot of really great doctors out there that know how to do this now, which is so exciting, right? Because we're entering into an era right now where children and adults, everybody, we need to level it up. We do not have the same kind of maybe lackadaisy lifestyle that we used to be able maybe to get away with. You cannot, in this world right now, with the amount of stressors that we have and wearing masks and kids, just a lot of uncertainty. Let's just leave it at that. It's so important right now for us to find strategies to help to make sure that we are armed and we are ready and we know how to strategize our way back towards health. And when we get into any kind of an immune crisis or healing crisis, that we know how to bring ourselves back. That's key. And that's really, that's what we do. That's what we do at Innovation Health. It's not, it's not that complicated, but it takes you have to be wanting and willing to make the commitment to go on this journey. Because I can't, when I'm working with patients, I tell people right away, I'm like, we're on this together, right? Because your body leads the way. We just learn to listen to your body, assess what's going on with these symptoms, because the symptoms are like the dashboard in your car. We don't ignore, right? We don't want to ignore, because otherwise you're going to end up on the side of the road waiting for AAA. In this case, we just, we don't want to end up in a crisis situation. We want to know how to stay on the side of optimal health.
I have one more question. With will you talk a little bit more about labs? Because I think a
Yeah,
lot of
let's do
people,
that.
yeah, okay, cool. Because that's where a lot of people get stuck, right?
Yeah,
Is my
sure,
labs are fine. I don't know what labs to ask for.
sure.
How are you learning so much information from blood chemistry? Because
Mhm.
the labs that I did with her were not expensive and you got a ton of information.
Yeah, yeah.
I think that's really powerful for people to know.
Right. So one of my commitments when I started on this journey of being a doctor and being a natural doctor was we want to be able to provide healthcare for anyone who wants to have better healthcare, which is that's a big goal, right? But, so Brad, my husband, and I, we just, started with all that chiropractic stuff. And chiropractic was an amazing way to get so many people to come. They would come in like at a 9 out of 10 pain and leave at a 2 with a smile on their face. I'm like, that I like being that kind of doctor, right? Now, some people it's not that quick. It just depends. But we don't want to create false expectations. But it's so nice when people are happy to come into a doctor's office because they know they're going to get good health care. So when I had decided to go down to get trained into functional medicine, the first thing that I decided that I was going to do was I was going to really spend time mastering how to get take a blood panel that doesn't have to cost thousands, right? And be able to extract as much information from that panel it's over 80 different biomarkers, but it's one blood draw, one urine catch, and then we go from there. And what I did also was I'm very blessed because I sought out some great practitioners and I got mentors. Mentors are very helpful. And as a matter of fact, Adri, who's now committed to doing this next step of her training, I said, go for it, girl. And I'd be happy to be one of your mentors. And so I was happy to hear
Part
that
of me
she
saying yes. That was an amazing offer.
Yeah, everybody needs a mentor and everybody needs a good practitioner that's going to help to make sense of things so that when you're on this journey, you're not going it alone, right? It's very hard to do this alone. Now, if you're on, just having needing a little bit of like a metabolic cleanup, you might not need this whole process, but for someone who's having chronic reoccurring issues, they're not able to find out how to get back on track, the functional medicine model is ideal. So I'm going to go ahead and share my screen and pull up Audrey's. This is the report that I put together for Adri. Everybody gets one of these because I'm very, very big into, I want you to know as much as you want to know, but you don't need to know everything. Right. And especially because when I start working with people, their brains are not always working ideal. So I don't want to complicate matters. We just want to get to the healing, but knowledge is very powerful. So we want to just give you an idea, like, where are you now? What are we going to do about it? And then we go from there. Okay. Can you all see the screen? Do I need to,
yeah.
do I need to minimize anything or is this?
Nope, looks
okay.
great.
So for the sake of time, let's go to section 3, where I'm going to go into my analysis and I'm going to go right down. I go through this whole thing and I end up with like, what are the things that are out of optimal ranges? And then we start to put the puzzle pieces together. It's like a connect the dots kind of thing, okay, that goes on in my brain. So here we go. Okay, I need to move this because I can't see that. Okay, there we go. Okay, so we have 83 biomarkers that I ran on this blood panel. This doesn't include the urinalysis, but the urinalysis is part of the panel. And out of that, at this particular time, back in May, she had 53 biomarkers that were on this spectrum here. She was in the zone of optimal. Optimals are based on healthy people over a period of time. When you're getting blood work done by maybe your medical doctor, or you're just looking at the standard ranges, these are the standard ranges over here, and beyond that are based on sick people. The labs compile all kinds of data, and they actually, interestingly, they keep making those ranges broader and broader and broader, which is not the way that you get healthier. They're just allowing levels of dis-ease or dysfunction to become more normalized so that they can make sense of it, get you into a disease management plan. I don't like that process. I don't think that's healthcare. As a matter of fact, it's anything but healthcare. That's disease management, wouldn't you say, Audrey?
Yes.
Yeah. So what's beautiful here is that you can see on Audrey, when we go to these spectrum, like the ends of the spectrum, the alarm low and alarm highs, nothing showed up. Right. By the time she got with me, there was nothing there. Where we needed to move things back in towards the center is here. We want to take these. Let's start with the below optimal. So the below optimals, think of those as like your nutrient deficiencies, maybe anemias, malfunctioning because you're not getting enough of stuff. That's kind of what it means. Okay. Doesn't always mean that you need to supplement. It might mean that you're not absorbing it. So we just need to work on getting your body to process food better. Right. And in your case, we're cleaning up that digestive terrain so that she's getting more of that. And that's why she has more energy and her brain is sparked and she's back to being fabulous Audrey. So the above optimals are going to be signs of inflammation, signs of toxic load, things that might be, just not getting processed properly. So now we have a backup in the system. So things that are above or below are going to show where we want to, figure out where to begin. So then I start to do my evaluation. I went ahead and went here because this helps to kind of give an idea of some of the educational parts of this. So these are her above optimals, right? So these are the things that we're going to be looking at quickly here, the nine above optimals. So we're catching things. We actually, if you look at the yellows here, above and below, if you just stay there, realize that we caught over 20 different parts of her body systems that were suboptimal function, right? When you can start to make changes here, a lot of times the other stuff can start to correct on its own, right? You're the captain of your ship. I'm just trying to help you get back on track. Your body knows what to do. For anyone out there who has children and you were blessed enough to birth those children or you are adopted and you're raising, every day we get evidence of how brilliant and smart our bodies are just by looking at our children, or just watching a wound heal, or watching your body recover from an illness, or a fever, something like that. So so what I see here is Audrey's got a lot of bound up iron. She's not using her iron, right? So again, this was before, and we're going back soon to get her new labs. But bound up iron is usually a need for, you got to have certain minerals and some certain vitamins to be able to get that working so that you can turn that iron into energy. And it's needed for you to be able to have oxygen and fuel for the red cells. If you have too much iron, it's like it can make everything feel a little rusty and cranky and inflamed. In her case, it was almost like too many things were on an Uber, like a transporter, and the Ubers weren't letting the iron get out, right? There was no opening the door and letting her take that and use it.
That's not great.
Anion Gap is where another really big clue, because Anion Gap kind of tells us what's going on with those blood sugars and how well she's digesting a lot of things, but mostly carbohydrate based. But it can really be if you have too much acidity in the upper GI in the beginning of digestion, it's going to be a problem. She's not going to be able to absorb, and so it's going to cause her blood sugars to start bouncing around. So she's going to get insulin surges, kind of ups. And we know what goes up must come down, right? So if we're getting spikes, we're going to get drops. And those spikes and drops, every time you're going on this roller coaster ride, it's going to be an inflammatory opportunity, puts more stress and burden on the immune system, causes more inefficient use of energy and conversion of food into fuel. So here we have lots of iron floating. I don't really spend too much time worrying about serum iron, because it could have been just what you ate the night before the lab work. But when we look here, we see bound up iron. And again, this has to do with her red blood cells. So when you're thinking about energy, fuel delivery, oxygen delivery, these are the transporters. This is a sign that her red blood cells were not maturing well, right? Not maturing well. So they're too large. They're having a hard time getting through the blood vessels. They need to be teeny tiny. So as red blood cells mature, they get smaller and smaller and smaller. So again, I feel like we're going into maybe a little bit too deep of a dive, but overall, I just want to show you, like, we have inefficient nutrition, lots of bouncing around of blood sugars by looking at some of these ups. These are things that are high. And then I saw the way that her blood fats were behaving. Yeah, not real efficient here. And so no wonder her hormones were out of whack, right? Yeah, especially things like progesterone, adrenals, the adrenals. Okay, so all that stress that you mentioned, Audrey, right? Oh my gosh, just, even having just to move out of the house, and you, before that, having the different symptoms with all you and your family members, and you being so tired, if you are that stressed and you're not able to handle the stress, well, now you're going further downstream. So how that can show up, and it did on hers, was that she was getting a lot of fatigue, mostly in the afternoon, real, kind of sluggish energy in the morning, and then also weight gain. Also things like, not in your case, but another real common things are sometimes we see that, like, we can get headaches. People get headaches, can be afternoon headaches, could be headaches that are exercise induced. So body having trouble just managing just day-to-day stressors, right? So the adrenals manage the immune system, the blood sugars, your sex hormones. And if those things are not able to stay stable, it's very difficult to get healthy. It's very difficult to have that longevity of health. So there was just a lot of cleaning up that we needed to do to get her to be able to digest better, and to start getting her to stop having so many of those bouncing around of her insulin, her blood sugar.
That's such powerful information, because I think, as women, we put a lot of pressure on ourselves of like, wait, I'm doing all the things, right?
Yeah.
Yet my body won't change, or my body won't do, what I need it to do. And it becomes very externally focused instead of this, wait, why aren't these things happening? Or why is my body not able to do these things?
Yes. And, that's very true. And then also things like yo-yo dieting, which a lot of women do, going on antibiotics, which is just that's just part of our society. Those things can start to really set up problems if we don't get that back into balance, and stop having these ups and downs in the way that the body, that terrain needs to be, highly functioning from beginning to end. So you chew well, you swallow, your body churns that food up, sterilizes it, and then it pushes it through into the small intestine. And then the small intestine needs to signal in its buddies, the liver, the gallbladder, and the pancreas. And of course, the brain is involved in all of this, to make sure that things keep moving downstream. A lot of people, I will tell you, that's where things get stuck. It's somewhere around the second and third phase of digestion, where they're not absorbing their food, or they're having a hard time taking toxins and mixing them with these enzymes that your body naturally produces, and then taking toxins and churning them down and turning them into water soluble, non-toxic molecules that your body just flushes out. And then it comes out through your skin, through your lungs, through your liver, through your bowels, like all the elimination pathways that your body knows to use, right? So if those aren't working efficiently, then you're going to start having backups. And so even here, like her vitamin D was high. Vitamin D, well, it's a fat soluble vitamin for one. It's actually kind of a hormone. It acts as a chemical messenger. It's an amazing, important part of many, many functions. And most people are deficient in it.
So what do you think changed? Because I forever was at like 32, and I could not.
I think that you were starting to open up those drainage pathways so that you could you could start to metabolize your fats. You could absorb it. You could get it into the cells. That's the first thing that comes to mind. Yeah. And then when you get those numbers down into, like, when your immune system starts to get more of what it needs, and you're reducing the toxic burden, your body will start to use vitamin D for other things rather than just fighting off infections. Okay, I just did that because I wanted to make sure when we got to 9, I would know where we were. Okay, so we're kind of.
We have a quick question with, what does that mean exactly, drainage pathways?
What was that?
Somebody's asking a question to just expand on what
was the question?
With drainage pathways, explaining how our drainage pathways simply
Sure.
put, how our drainage pathways work.
Okay. So, a funnel is only as good as the bottom of the funnel, right? And a funnel starts out wide at the top and it starts to get smaller at the bottom. So imagine that if we have we have different parts of our own funnels inside our bodies. The bottom funnel would be like your colon. What's going on there, right? So when we go back to like, your bowels, how are your bowels behaving? Or other things on the metabolic assessment, which I like to ask are, do you get lower abdominal pain, like abdominal pain, lower, like below the belly button, that feels like it relieves when you pass gas, or if you're having like a lot of bowel movements. So, or if you're not having bowel movements enough, that can start to change that dynamic at the very bottom of the drainage funnel. So the drainage funnel kind of is made up of layers. So I think of it as like, are you pooping every day? And if so, what's the quality of the bowels? Is your skin good? Like, are there any indications that you're having like that abdominal swelling, or if you're having too much gas after a meal? That's saying that the liver is stressed or something along that. So that's like the next phase of the drainage pathway is it's the liver, then the colon, and then above that, when we get to like along with the liver, we really should not bypass that. We want to have a healthy gallbladder, because the gallbladder is very vitally important to all of this digestion. So that's what a drainage funnel is. It's like if there's anything along the funnel, whether it has to do with your cells or in your organs or the way that your body clears out toxins, if anywhere along those funnel points things are not efficient, your body is going to be more prone to having more toxicity, and then the toxicity starts to change the terrain. Does that make sense?
Yeah, that's great.
Okay, so we're really all along, we're looking for clues like that to make sure, like, we want to have good drainage. So again, I'm going to go down a little bit more. Oh, here we go. Look at this. So with Audrey, we saw that there was a little elevation of one of her white blood cells that deals with a lot with bacteria. So yeah, that could create a lot of this, what's going on. Her terrain is now, rather than having healthy bacteria that's working to keep the checks and balances and produce all the, that healthy microbiome, her body was in competition with unruly little buggers that were stealing her energy, stealing her food, not meaning to be bad boys or bad girls. They behave, they're opportunistic pathogens. Opportunistic pathogens are going to do what they do. When there's an opportunity, they're going to just sort of take over the terrain. Okay. Just like weeds are going to take over soil. So we just need to get it back. Now we go to the below optimal, and just to kind of show you some of the deficiencies. Whoa, these triglycerides are aiming towards the low. So that's going to be an indication of not very efficient stored energy. So anytime Audrey's, say, stressed, or anytime that she's needing more energy, or she's been exercising, or maybe she's really having a busy day and she skipped lunch, and she, normally we would be able to have backups that could pull energy and turn it into fuel so that we don't have those drops, which lead to the inflammation or the surges, highs and the lows that we talked about earlier. So she didn't have a really efficient backup. It's like her savings account was being depleted, more than likely from all that the stress that she was under with the chronicity of her problems, also causing her immune system to take a bit of a beating. And so she was having, like a globulin is it's a molecule that, if you think about, like, if you've ever had any kind of immune testing done, immunoglobulins, right? We hear about immunoglobulins. They help us to make antibodies. They help us to fight the fight and, kind of get back on track, recover from inflammation or infection.
I have a lot of information on data in you and Kim Thomas you.
Can everybody check to see if maybe Kathy?
I just fixed it. I'm sorry.
I don't have access to you. Sorry.
That's okay. So what we want to do now is, I would say, again, just giving an overview of what's going on, and then what do we do about it? So, I kind of like to put together going back to that 40-foot view, and we look at the things that are possible.
Listen to it. Don't turn it off.
Yeah, I think that we're getting some feedback. Somebody needs to turn off.
I think she's trying to either get off or
Okay.
mute. Maybe Kathy.
Yes.
Okay. Are you trying to mute or to get off?
Yes.
Okay.
Yeah, I can't. I can't see the screen. I can't get back to the screen. And my husband came in and started talking. I'm so sorry.
That's okay, Kathy.
Totally fine.
That's
Um,
okay.
I'll figure it out. Sorry, we won't talk anymore.
Right.
No
So,
problem.
here we go. We kind of can make justifications like the pH. I talked about, again, just putting together connecting the dots, coming up with the rationale behind what's really going on here. And we can see that, rationale for her is that her terrain had just become too acidic. We need to get that to be more alkalining so that her terrain of her stomach mucosa needs to be able to absorb and do what it needs to do to turn that food into energy, and even further downstream into the small intestine and the large intestine. So everything from north to south. And then we want to look at these deficiencies, look at these needs and say, okay, really what's going on here?
Sorry, I can feel better.
Well, I'll tell you one thing, when somebody needs magnesium, when they're low in magnesium gets burned. When you have stress, magnesium gets utilized very quickly, like a bandit. It's just you're going to burn through your magnesium. So even if you're eating a lot of magnesium rich foods, if you're having a problem with the absorption, that's going to create this imbalance. So really, it's just all about getting things back into balance so that we're not having you're not on the roller coaster ride. And getting those blood sugars and cleaning up the digestive system, that really right there is so much a part of the healing process. So much so that when I really, continued on this journey, I thought, okay, well, where do we start with people? Where do we get going? And that's where I want to really end this part of the conversation was, I think that Adri is ready to get back to work. I think Adri is ready to help to get in alignment with, helping people with their diet and their lifestyle, and even the emotional component of health, which is really her wheelhouse. And I love doing this too. So what I'm going to suggest that we do, Adri, is that you and I, and anyone that's on this call right now, or anyone that maybe knows somebody who couldn't make it on the call, but really wants to start somewhere, they want to start this process of healing, or just leveling up so they're preparing for what's coming up, what's happening, fall's happening, we're getting ready, we're going into a new season. This is a great time to do a metabolic cleanse. It's a great time to clean up our own terrain and make sure that we just clear the mucky waters so that we can lower the toxic load, because we all have them. We can't get away from it. As a matter of fact, on a side note, Adri, do you know that I was reading that over 17% of our GP, the gross GDP, right? The GDP, like the overall cost of things, over 17% is towards managing chronic disease from the inefficient, or chemical toxicities from that are in our air, that's in the water, that's in the soil. So one of the things that I like to tell people is that we don't want to be afraid. This is the world we're in right now. We need to get smarter. We need to have strategies so that we can keep our drainage funnel, the thing that I was talking about earlier, we can handle the demand, right? So we have to figure out what is causing this toxic buildup and clear it out. So I thought, why don't we do this for 4 weeks? It'll take about 4 weeks. We maybe do, starting maybe at the beginning of October, and go 4 weeks out so people can start to prepare. Audrey and I can plan this out, put together a protocol and a set fee where we can assess. Everybody can you'll get assessments, metabolic and neurological assessments. You fill them out, and then on week 1, we come together and we discuss the metabolic assessment process, and we get down to the nitty-gritty of what's going on with you. And you identify your top health concerns, and then we can maybe do a group. I've always wanted to do a group healing, like a group like this. What do you want to call this? A group cleanse. And I think now there's no time like now. So second week, Adri, and maybe a little bit of me as well, but mostly Adri, health coach Adri, can go in and start getting your house, getting you prepared for a 15-day metabolic cleanse that we can do together. And during that time, we'll clean up the diet, take out some of the food triggers that are known to be problematic, maybe not for you, but we need to find out. So we remove those and we start to flood the body with lots of nutrition, fill in those nutrient potholes. This is all before we do any lab work, okay? Because if you go and you get labs before you cleaned out and kind of cleared away some of the muckiness, what's going to happen is you're going to find a lot of stuff going on and you're not going to know where to begin, right? So the first step for most folks is to just start getting let's clean things up a bit. So during that, you'll be able to have support, and then maybe on week 3 and 4, we'll do maybe week 3 we'll do a Q&A, and just people can get back on and let us know what's going on. They might need some help. It might not be 100% everybody's on the same exact thing, because when I do the assessment, some people might need adrenal support to help them through the metabolic cleanse. Some people might need something else. So it'll be customized, but it'll be simplistic, and we'll be able to do this without causing too much chaos in your day-to-day. But there will be changes, and you have to be willing to do that. So if that's something that you want to do, then my thought is that at the end of that journey, at the end of the metabolic cleanse, then touch back and we'll say, okay, you know what, let's get some lab work now. Let's run one of these panels and do an evaluation and see what's going on. See what's going on with you now, right? So that we can, if we need to, plan out another make it a more personalized next step, like we are with Audrey. Audrey, what do you think about that?
I think that sounds
You ready
fantastic.
to do that?
Yeah, and I like it. I like that I like the approach of, let's go ahead and do some of the cleanup work first, and then do the labs and see what's going on. But I love that you do the metabolic assessment first, so that you do have that information and it can be more customized. Because I think a lot of people have done cleanses or, elimination diets or different things. But as we've learned tonight, right, we're not one size fits all. So to know where the body needs extra support, so that the drainage pathways are starting to work better and the body can start to do its job. I think that's a really, really great approach.
Great. So I think that doing it in a group fashion might work for some. Other people might say, you know what, that doesn't work for me. I'd really rather just do one-on-one with you. I don't really, want to have it be if with everybody else. That's fine either way. But as a group, we can learn from each other. We'll have support and we'll have community. And you won't feel like you're going it alone. And who knows where it's going to go. I just think we have to just start, aim the arrow, and then just shoot. And then we'll maneuver as we need to along the way. And with Audrey and myself there to support you each week, that it seems to me like it would be a great way to prepare for this next season. To start to uncover what might be some of your health concerns that, maybe you're in the middle of some work with another doctor and you feel really like you're at a point where you've made great changes and now you want to get to that next level. Maybe there's something else that you're still wanting to address. So it was something that I thought that maybe we would be nice. We have a nice show up of people that clearly are interested in learning more about functional medicine. On top of that, I do want to say that anyone who also wants to have that initial chiropractic examination, which is hugely vital. But listen, everybody has to. It's what you want. It's not. I can say what I want you to have, but if you want that, then we have well, listen. And some people have insurance, so it might even be less than this. But that first visit for an examination and any treatment that might be needed that day is no more than $99, right? And if they have insurance and we'll bill their insurance, it might even be less. It might just be their copay or their deductible. So I've got a great team. They verify all that stuff. So I just want to make sure that people know that, like, that initial step is just to get on the schedule, have an examination at our office, either by me or Dr. Wolf, where we're like-minded, although, we have, different views about things. It's really nice. You kind of get you get 4 hands and 4 eyeballs on you to help you uncover what's going on. So those are the kind of things that I find are super helpful. And now I want to open up, Audrey, why don't you go ahead? If there's anybody that has maybe a question or two, maybe we want to go into that.
Yeah, Adair asked, she said she's interested in metabolic assessment, but wanted to know a little bit more what helped me overall. So I guess sort of speaking to then the customization of the supports
Oh,
that I'm
okay.
on. Yeah.
Okay. Yeah.
Yeah.
So, and this is, I'm sorry, who asked this question?
Adair.
Adair?
Mhm.
Hi, Adair. Great question. Okay. So we start with, what are the, what is like the low hanging fruit? Like, and I said, it usually has something to do with opening up the drainage funnel, opening up the way that your body's cleaning out toxins. To customize, when we get to the lab evaluation and I really get into the customization, is that what she's asking, Audrey?
Yeah, I think it's more like the supplement support
Okay, yeah.
and knowing
So,
what my body needed in addition to diet.
yeah.
and lifestyle.
So initially with what we're talking about, if we do this group cleanse, it will be based on what I see on the assessment forms. I'll help you to interpret, what's going on based on what you're saying. Like, okay, so for instance, you rate yourself between a 0 and a 3 for different metabolic functions in different categories that relate to different organs and different body systems. So if there's a lot going on in the liver and the gallbladder, and they're seeing like, a lot of what Audrey has going on, we're going to make sure that we, again, just start by getting more nutrition in the body and giving the digestive system a little bit of a break. So we will maybe customize more like metabolic shakes so that some of your meals are going to be kind of done for you. Not all of them, but some of them, and then give you different supplements that are going to be rich in antioxidants and phytonutrients. They're going to help to, kind of tame down the toxins, right? And then making sure that you're getting enough bile flow, making sure you can turn the toxins into, like I said, just churn them down, turn them into water soluble, non-toxic molecules, and then your body can clear them out. So somebody, let's say they have like constipation, we might need to help them along with a little bit extra support with that, maybe, but not something that would be like to force the movement. It's just to encourage the movement, to clean that terrain. Now, when you get into my office and we get into more of a deeper dive, like Audrey is, I do I do apply kinesiology testing. It's sort of my own thing, but I guess the best way to describe it is I do muscle testing, and I have a variety of different vials, and I take the vials based on what it is that we're aiming towards and what I'm kind of feeling you need, and we'll just keep asking the body, is this what you need? Is you need? And I'm looking to see what's taking a weak muscle and then making it strong. So those of you who have had that, what I'm talking about. It's very powerful, because again, it's trusting that your body is going to help lead the way. Your body will know. If we can just you're not even putting this in your system yet. We're just keeping it near you, and then testing the muscle, a weak muscle that might be related to, say, the liver. And we can see what's making it stronger. Then we know that gives us an insight as to, okay, that's the direction we need to go in. And then we customize it with dosing and timing and try to get as specific as we possibly can, give you guidelines so you have great successes, right? Yep. Does that help? Does that help you with the answer?
I guess she's probably muted. I'm guessing yes.
Okay.
I'll answer any other questions she has.
Yeah.
I think somebody was asking more about, and I can touch on this real quickly, just the point that I had to get out of the mold to heal, that my body was not going to heal if I was if I was still exposed to the mold. So I think that is a key component for people who are dealing with mold exposure, that the body cannot begin to do the healing process until your environment is clean.
And on that note, that also can be like toxic relationships, toxic job. I mean, all kinds of things that might be, consistent stressors in your life. But absolutely, if the air that you're breathing in your own home is not healthy, then you can't live in that environment and think that you're going to heal. There's not enough things that we can throw at that until we heal that and, seal that up.
Right.
Yeah. So absolutely. Sometimes the lifestyle changes are small. Sometimes they're quite big.
Right. Okay. I know we are so grateful for everybody's time, and I know everybody's probably ready to put their PJs on, but I know we could
Definitely.
talk for so much longer. But Dr. Pfeiffer, thank you so much. That was incredible and just so generous of you to just spend so much time educating us. And I know I've already, been getting texts from people that are just really grateful for this information.
Fantastic.
So I think, next steps, make sure that you're connected with me or Dr. Pepper, so that once we get more of this group figured out, that we can send a communication out to you. So whichever way you learned about this call tonight, reach back out so that we can make sure that you get the information that you want.
Yeah. And I know that we both have websites. So do you want to share your website, and I'll also share mine? So
Mine is under construction, but it's www.thewholetulip.com.
Awesome. I love the name.
Let me do my email, because it may just be easier right now for you guys to email me directly. Nope, that's to Haynes. I don't know how to do this in a regular chat. My email is ADRI Warrick, WARRICK @gmail. And then Dr. Pepper, do you want to give your information?
Sure. So the place to begin would be go to the company, our company, our center is called Innovation Health. We're in Charlotte, North Carolina. This can, I do work with people that live in other areas of the country. I don't do overseas, but I do here. So if, some people have relatives or loved ones in other areas, I can still do the lab evaluation and help them to get started. I work with a lot of people in other areas that way. Only word of mouth. We don't do a whole lot of advertising on that, but the email, or not, sorry, the website is the letter I health, NC, North Carolina, NC.com. So ihealthnc.com. You can navigate your way through there. If you want to reach out and, just talk to us and get some more information, that's fine. If you want to fill out an intake form and get into our system so that we can start processing you as a patient, that's great too. It's really whatever you want. Okay. I do think the idea of doing a group metabolic cleanse in the month of October, if you guys are interested in that, let me know. And like I said, I think that it would be really nice to get that before I run any lab work on somebody who really hasn't had labs in a while. That would be the way to go. Someone who's been told, my labs look great, but you don't feel great, this is the way to go. Okay, that's what happens. A lot of people, they're told everything looks great on their labs, but they're not looking at the labs properly. They're not really they're not looking at the pieces and connecting the deficiencies and the abnormalities and making sense of the madness. So yeah, so that's what's going on. And I'm so grateful that you guys were all able to make it tonight. And this was really wonderful. Audrey, you're just a beautiful being. And I think that your story is so inspirational. Just from, you didn't give up on yourself. And that's really the thing I want to end on, is that never, ever stop looking for answers. Okay. I promise you, answers are out there for you. Your body will heal. Your body wants to heal. Your body wants to be healthy. And oftentimes when we can look in between the lines, kind of like in between those spaces where it's maybe not the most obvious stuff, but we look in between the spaces and say, oh, okay, you know what? You're getting triggered by eating too much of this and not enough of that. And then you've got this real stressful job. We need to have a strategy for that. So
exactly.
Strategize your way back to health. Okay.
Exactly.
So then you can feel like you can handle anything.
That's right. That's right.
Life comes at us hard sometimes, and we just have to be able to stand tall and know what to do and know how to turn it around.
Right.
So,
right. Oh, great. Well, thank you so much, everyone. Have a wonderful evening. Bye.
You know what else I was going to say? Oh, that's fine. I was just going to give them my